Welcome. Case 15. Let's start. Seizures, irritability, poor feeding, and fever strike a newborn after 10 days of delivery. The baby's birth records show a prolonged labor and a premature membrane rupture. CSF direct antigen latex agglutination is positive for group B Streptococcus. Combination antibiotic therapy with penicillin G and aminoglycoside is started. So it is very well and clear cut case. Any guesses? So yes, it is a case of neonatal meningitis, but because it is after 10 days of delivery, it is late onset neonatal meningitis. And because latex is positive for group B streptococcus, that is Streptococcus agalactiae, and this is the most common cause of neonatal meningitis worldwide. So let us understand detailed pathogenesis. So these bacteria, they are present in maternal genital tract. They have serotype 1A, 2, 2B, 3, and 5. They colonize the newborn following obstetrical complications such as prolonged labor, premature rupture of membrane, during or before birth. And that may lead to early onset, that is less than 7 days of birth or within 7 days of birth, uh, pneumonia. So this pneumonia manifests as respiratory distress, lethargy, hypertension within a day after birth, which is usually most commonly seen, or it can also manifest as a sepsis and meningitis. And ultimately, mortality is 4 to 5%. But the serotype 3 of this bacteria, it colonizes newborn after birth, following contact with colonized mother or healthcare worker like nurses. And this is usually late onset, that is more than 7 days in this case. So 7 to 19 days after birth is the usual period of acquisition. And here, instead of pneumonia, the most common manifestation is meningitis. It could also be sepsis. And mortality rate is little bit lower, that is 2 to 3%. So here, because it is a neonatal meningitis, late onset is there. So which investigation we should do? So CSF latex agglutination is usually positive for group E Streptococcus. We can also do gram stain of CSF, urine and blood, which will show gram-positive cocaine chain. But most important investigation is CSF or blood culture, which will show gram-positive cocaine chain, which are beta-hemolytic, catalase negative, and bacitracin resistant. There is another taste which this bacteria give is CAMP taste, that is Christie Atkins Munch Peterson taste, CAMP taste, that is positive by this bacteria. Treatment: high dose intravenous penicillin G or benzyl penicillin or ampicillin for 21 days, along with gentamicin intravenous for first 7 days. Uh, if person is allergic to penicillin, then we can also use high dose IV chloramphenicol instead. Prevention, we can give ampicillin prophylaxis to pregnant women who taste positive for this bacteria. And we can give a polysaccharide protein conjugate vaccine, especially in pregnancy. That is a future prevention option.